There's been a major overhaul to staffing and funding at agencies that fall under the Department of Health and Human Services since President Trump took office. At the National Institutes of Health, 1,300 employees have been fired, and more than $2 billion in research grants have been canceled since January. The agency says it is the largest public funder for biomedical research in the world. The Centers for Disease Control and Prevention cut its workforce by about 2,400 employees earlier this month. The Food and Drug Administration initially reduced its workforce by 3,500 employees, but CBS News has learned some of those FDA firings will be reversed. CBS News digital reporter Alex Tin joins us now for more. Alex, what kind of ripple effects will these cuts have?
Yeah, look, we are already hearing about a long list of effects from all of these cuts, everything from the entire, National Institute of Occupational Safety and Health at the CDC being cut. That's affected everything from mine safety research all the way over to how the N95 respirators are supposed to be approved into this country. All of that process has been paused, all the way over to those FDA layoffs that we heard now being reversed. Part of the reason we think that they were reversed is because a lot of the food safety and drug safety testing that the FDA is supposed to be doing, all of that had been paused due to those cuts. And of course, those are just the immediate term impacts. Researchers have been warning for a long time now that they're worried about the long-term impacts this will have, not just on research in this country, but the larger biomedical enterprise that is based on this, process, this funding, and these staff that are now off the job.
Health and Human Services Secretary Kennedy has been pushing for more studies into autism, cutting back on red dyes, removing fluoride from drinking water. Is there a timeline on when these will come into fruition?
Yeah, the timeline has been shifting, but they are targeting a pretty aggressive timeline on all of these. On the dyes that you mentioned, the FDA has said that they want the food industry to pull them out of the food supply by the end of 2026. But it's important to note that there's no actual teeth to that agreement, as they're calling it. There's no actual ban on those dyes. They just have this voluntary pledge. On the autism study, the timing has shifted a little bit there, but our latest reporting is that they are hoping to have some preliminary results by next year at the earliest. But of course, you and I both know that experts have been warning for a long time that, actual answers to the so-called causes of autism, that's probably not something that's going to be solved within the next, year or two, or probably many more.
The measles outbreak centered around West Texas expanded throughout the U.S. during the administration's first 100 days. What does the administration's handling of the outbreak tell us about how the U.S. could respond to future outbreaks?
Yeah, it's interesting about this measles outbreak, right? Everyone was saying during Health and Human Services Secretary Robert F. Kennedy Jr.'s confirmation hearing that the real test of all of these questions people had about Kennedy, his stances on vaccines and questioning their efficacy and safety, his approach to, handling these agencies, and obviously the major cuts we've seen in staff at these, health agencies, that all of them would come to a head at some type of disease outbreak. But I don't think anyone was expecting that outbreak to happen so soon and so large. As you know, we've had this record measles outbreak in Texas and neighboring states, also happening over the border to our north in Canada. And in that contrast between how the U.S. has handled its measles outbreak and how Canada has handled its measles outbreak, we've seen a lot of the differences, not just in how Kennedy and his aides are talking about the measles vaccine and talking about encouraging people to get that shot, but obviously differences in how they're handling the day-to-day boots on the ground work and actually investigating those outbreaks. One interesting data point, even though Canada's measles outbreak is larger, it's the U.S. outbreak that has had 2 deaths, not Canada's.
Alex Tin, thank you.